Our clinical guidelines, different for primary and secondary cholesterol prevention. Imagine your heart health as a journey with different paths depending on where you stand. Some people are just trying to keep their hearts safe, while others are working to prevent further problems after a heart event. That's where clinical guidelines for cholesterol management come into play, and they actually vary quite a bit between these two groups. In primary prevention, the goal is to stop heart disease before it starts. This means focusing on people who haven't had a heart attack or stroke yet. Doctors usually recommend lifestyle changes first, like eating healthier, staying active, and managing weight. If these aren't enough, they consider medications called statins to lower bad cholesterol levels. The decision to start medication depends on your overall risk of developing heart disease, which is calculated using factors like age, blood pressure, smoking, and cholesterol levels. For people at low to moderate risk, statins might be recommended if their LDL cholesterol, often called bad cholesterol, is above certain levels. For example, if LDL cholesterol is 4.9 millimoles per liter or higher in low-risk individuals, medication might be suggested. For those at higher risk, the threshold is lower, like 1.8 millimoles per liter, meaning doctors will consider starting statins sooner to keep cholesterol in check. Now, secondary prevention is a different story. It applies to people who already have a history of heart disease or stroke. These patients are considered very high risk for another event. Because of this, the guidelines recommend more aggressive treatment. Almost all of these patients are advised to take high-dose statins to push LDL cholesterol below 1.8 millimoles per liter or even lower, like 70 milligrams per deciliter. If statins alone don't bring cholesterol down enough, doctors might add other medicines such as ezetimibe or PCSK9 inhibitors. The main aim here is to reduce the chance of another heart attack or stroke by lowering cholesterol as much as possible. So, the key differences are in how risk is classified, the thresholds for starting treatment, and how aggressive the treatment should be. In primary prevention, doctors look at individual risk factors and set higher LDL cholesterol targets. In secondary prevention, everyone with heart disease is treated more intensively to lower LDL cholesterol to very strict levels. This personalized approach helps ensure each person gets the right care based on their history and risk level. It's all about tailoring treatment to prevent future problems and keep your heart healthier longer.